Hello, my name is Todd Stepaniak and I'm the President and CEO at the Middlesex Hospital Alliance. And with me today is Don Butler, the Board Chair of the MHA. And we're very excited about the launch of our new strategic plan for our dynamic organization.
The strategic plan was a large initiative for our board last year. We spent most of the year working with the management team, external consultants, with the individuals in our community. We did a number of focus groups, and we have, at the end of September, we approved the new strategic plan for our organization. The strategic plan included a new vision for our hospital, which was exceptional care by exceptional people. We're excited by that vision and want to ensure that the community knows the new vision for the hospital. But when we looked at our mission, we really felt that the mission that the hospitals had for a number of years really resonated with all of us. So we just renewed our mission. It is to provide the health care we would expect for our own families. That is truly what this hospital stands for, and it really is how we expect care to happen in our community. Our values have remained the same, and we're looking forward to continuing to serve the community that way. We have some exceptional pillars, and Todd will speak to those.
So as Don mentioned, we have developed a very comprehensive and forward-looking strategy based upon our renewed mission, our new vision, as well as our reinforced values. The new plan accurately captures, as Don alluded to, the feedback, collective wisdom, and input and insight that we had from many, many people, both internally and externally. So their fingerprints are all over our plan. In addition to that, though, it's really important to also indicate that the declaration, this is a declaration to our communities, as well as to our MHA family about what our core focuses will be over the course of the next number of years. So while it's true that healthcare has undergone rapid and dramatic changes, it will continue to undergo those changes. And as an organization such as MHA, we're very proud of the fact that we continue to offer high quality care and value, really twin inseparable priorities for our organization. And this new strategic plan really reflects that and builds upon that going forward. So we have 5 core strategic pillars that we really heard loud and clear by our constituents. We heard that quality of care was first and foremost in the minds of people that were interviewed, that were part of the focus groups, and that were engaged. And that entails a number of different things. We recognize as an organization that it's incumbent upon us to continue to create exceptional patient care experiences for people, as well as for family members. And those individual touch points and patient encounters are so critical for people when they access our front doors, whether it be at the Fort County site or at the Strathroy site. Secondly, and equally importantly for us, is our people. We recognize as an organization, as does the board, that what really differentiates us from every other organization is our culture. And our success as an organization is to a large part attributed to our phenomenal staff, physicians, and volunteers. They really are the hands and the hearts of our organization, and our success is really attributed to each and every one of them. So as an organization, we need to continue to look at how can we continue to attract, retain, and recruit the best individuals to provide the best quality care in a patient-centered environment to you, our patients, as well as our family members. Third, our resources. Without question, the healthcare system, as I mentioned a few minutes ago, has undergone rapid changes. And it's critically important more than any time before in the history of healthcare that we continue to be value-focused. We recognize that in excess of 80% of our funding comes from the provincial government, the taxpayer, if you will. So we continue to ensure that we are providing a very cost-effective, efficient service within our 2 respective hospital sites. But in addition to that, we also recognize the importance of having a modern infrastructure within our organization. And we're committed to ensuring that we have the best available equipment in terms of meeting patient care needs and patient demands, as well as infrastructure, as well as the building itself and the building envelope. So that's something that we will continue to drive as an organization. Further, we know that innovation is of critical importance to us. And in fact, the board goes on record on a number of occasions of saying we need to continue to redefine ourselves on a daily basis. But it's really about practical innovation. And we demonstrate that each and every day. We demonstrate that in the most simplistic of tasks, as well as in more practical, innovative approaches to patient care. So for us as an organization, we recognize that innovation and that innovative engine is going to continue to help us as an organization better meet the needs of our patients moving forward. And finally, of course, in this time of integration and regionalized healthcare approach, partnerships and relationships are more important than ever in the history of this organization. We take a great degree of pride as well as energy at a governance level as well as at an operational level, looking at building upon our relationships with our key strategic stakeholders, our healthcare partners, and allied health agencies to make sure that we're providing a seamless delivery system as opposed to trying to minimize the number of handoffs that we have for patients once they access our doors or once they exit looking for other services that we may not offer in this organization, but are sure to make sure those handoffs, are as simple and as straightforward and simplistic as they can be in the best needs of our patients moving forward.
So from the board's perspective, we're very excited by the pillars that Todd has outlined just now. The board is working through what the goals will be for the organization. Management is working through how they're going to achieve these pillars, but they are really going to take us forward through to 2019. We're very excited. We're excited for the community and the continuation of quality health care for everyone in the communities of these two hospitals. So thank you very much. We're very excited by the strategic plan, and we look forward to working with you as we move forward.